He's covered 2 World Games, Tokyo and Paris Olympics, and 4 European Games. Last year, he successfully passed his fellow of the Western Company of Farriers. Congratulations, Andrew. Andrew Bowyer.
Thank you very much. Well, first of all, thank you very much to Dan and the BFBA for inviting us, all the speakers here this weekend. We've been really looking forward to it. We know what effort you put in to make this event happen. And also a massive thank you to you all for coming straight through the doors and heading for the lecture theatre to learn some knowledge. I promise you all those bargains would still be there later on. So, pathology of the navicular bone and podotrochlear apparatus, I feel, is a really relevant subject to be discussing this morning. 50% of forelimb lameness is isolated to the coffin joint, and over the years I've had my fair share of head scratching moments trying to get these horses sound, and I'm just really here to share my knowledge and some key points for you all to take home. So I'm just going to cover what I'm going to be talking about. I'm going to be going through definition, function and anatomy. And I'm very lucky that Lindsay Fields from New Zealand has given me permission to use some of her crystal clear anatomy images. I've been following her from a couple of years and learnt a bunch of stuff. We're going through pathology and causes, mechanical orientation of the coffin joint and the loads and forces placed upon it, and how us as farriers can influence the coffin joint with how we shoe them and what we do underneath. And I'll be going through our shoeing methods. And I'm concentrating a little bit more what to do at the onset of injury, when we get those really lame horses, and in that initial rehabilitation period within that first month, it's incredibly important how we suppress inflammation in the coffin joint to get the best possible outcome. Now, the coffin joint really is the heart of the horse's foot. It's exposed to some incredible forces and loads whilst that limb's in locomotion and that limb's rotating around the coffin joint. But the main function of the navicular bone is pretty damn simple. It's just to provide a fulcrum or a scutum for that DDFT to run over. But what it does do is it also ensures that the DDFT inserts into the coffin joint, into the distal phalanx, the pedal bone, at the same angle, no matter where that limb is in the stride phase. So it's a really important bone to make sure our horses are moving in a nice outline and we've got a nice flowing stride. So is navicular a disease or a syndrome? Well, disease is really just isolated to the bone. It refers to disease of the bone. And it's demineralization and structural breakdown of the integrity of the bone. And the bone is made up of 2 different bone compositions. It's made up of cortical bone and trabecular bone. It's a very unique bone. And on this lovely, healthy, wet sample we've got here in figure 1, we've got a really thick layer of cortical bone on that distal aspect to support the forces from the DDFT. Now, the center of the bone is made up of what's called trabecular bone. It's a unique structural arrangement of vertical columns, a bit like honeycomb, and this is interspersed with blood vessels to give the bone its nutrition. And the trabecular bone gives the bone its strength, but it also makes it a very light bone. It amazes me how light the bone, as is the P3, because there's a lot of gaps and spaces in the middle of it. Now, in our second image here, we can see that the cortical bone on the distal surface is starting to be demineralized, and our trabecular bone is starting to become irregular. And then on our third image, we can see we've hardly got any cortical bone whatsoever, and our trabecular bone is becoming very transparent. So you can see how the center of that bone demineralizes and breaks down. And quite often when we look at a bone or we look at x-rays, we just look at that peripheral border, but the damage happens from the inside out. And in our fourth picture here, it's gone completely the other way. That trabecular bone has turned to what's called compact bone in a process called sclerosis. And when we get sclerosis, we can get circulatory congestion within the bone, and that can manifest into a bone edema or a bone cyst. And here we can see that we've got a tendon lesion where that fibrocartilage, where the tendon runs over, that's worn away. And we've got some fibers that have frayed off the tendon and adhered to the bone. And that's pretty catastrophic for the horse. So the navicular bone is a very unique bone in the equine. And the reason for that is every surface of that bone has a function. It's constantly being compressed and pulled and pushed in every direction. And it's a highly active bone that's constantly, under a constant state of metabolism. It's constantly remodeling because of these pressures pasted on it, where bits are either added on or bits are taken away. And that bone can remodel and retract under pressure, or bits can add on. So if we get a tiny little ligament tear that tears away from the bone, we get an osteoblastic function, an osteoblastic process, where we get more bone laid down. We get a little sharp spur called an osteobite. Now the bone itself has got two articular surfaces, and this little articular surface here that looks a little bit like a moustache, which is my favorite. This one here connects to P3, so this is our small articular surface to P3, and then we've got our larger surface here, which connects to P2. Now, along our proximal and distal border, we've got holes in the bone which are called invaginations, and this is where blood vessels ramify the bone to give it nutrition. And then we've got our distal impar ligament that runs the distal border, and then our proximal border, we've got our navicular suspensory. And the largest surface area of the bone is our tendinous surface. It's a really big area to try and distribute those forces from that tendon over the bone. Now, navicular syndrome is breakdown of the soft tissue structures around the bone that help hold and suspend that bone in place. So we've got our distal sesamoidian collateral ligament, our navicular suspensory that suspends our bone, the distal impar ligament, the navicular bursa, the T ligament, and the deep digital flexor tendon. And in answer to Paul Duddy's question, what is the podotrochlear apparatus? Well, that is the podotrochlear apparatus. It's all the suspending and supporting structures that are involved in the coffin joint. Now, our T ligament, its only structural property really is to close off the back of the joint. It's like a wall, and it runs all the way around the back of the joint, closes the back of the joint, and keeps all the synovial fluid in place. Then we've got our void in front of that, which is called our palmar pouch, and that's a little bit like a synovial reservoir. And when that starts to collapse in, we can get poor synovial production, and we can get poor synovial lubrication to the joint. We've got our collateral sesamoidian ligament that suspends our bone from the top. It's a massive ligament. Then we've got our distal impar ligament, which is a very small ligament that connects the distal aspects of our navicular bone to P3. Now, the distal impar ligament is interspersed with something called substance P, and substance P means that the structure has got nerves and pain receptors in it, and it's highly responsive to pain. So we only need a tiny little tear in that distal impar ligament or a little retraction from the bone, and we've got a very, very lame horse. We've then got our navicular bursa, which is a big sac of synovial fluid, which is a lot bigger than we think it is. And then runs all the way from our distal impar ligament all around the distal quartile of the bone and butts up against our T ligament. Then we've got our deep digital flexor tendon that runs down the back of the limb, over that scutum, inserts into the bone. And this is where we get our elongated tendon lesions that run down the back of the pastern and migrate over that bone towards the insertion point. The digital cushion isn't technically in the podotrochlear apparatus, but I really think it should be, because that digital cushion really supports those structures and holds them all in place. Now, we have to remember that a sagittal section is just a 2D insight into these structures. And when we shoe horses, we think, oh, navicular bursa or distal impar. The first thing that pops into our head is that 2D image of that sagittal section we were taught at college. But it really is a three-dimensional structure that we have to really consider when we're shoeing these horses. And you can see the navicular suspensory here is a massive ligament. It only has one insertion, so it technically bifurcates, and then it extends proximally up around the pastern and inserts into the medial lateral distal aspect of P1. And then we've got our distal impar ligament, which is a tiny little thin layer that runs along the distal border. Now, there's a very complex circulatory system that provides the bone with nutrition. And I only realized this a few years ago and read some literature on it, but those little tiny microscopic blood vessels actually intersperse through the distal impar ligament and through the navicular suspensory to get to the bone. it's ramified the bone from all four sides. But when we get tension in those ligaments, or we get strains or damage, it also damages those blood vessels, and then we can get a process called vasoconstriction where it starves the bone from nutrition. Then we got our navicular bursa, which extends up above the bone, and then we've got our DDFT that sits over the top of that. So it's really layered up. Now, if any of you ever get the opportunity to go on a foot dissection day with Jay Tovey or Stephen Hill, make sure you do it, because you'll learn a hell of a lot. And when I went on one of these days, I was really interested in this area, and I was amazed at how thick that navicular suspensory is. You really have to saw through it with a scalpel. It's a really tough structure. And at its point of insertion, it's actually thicker than the DDFT. And you can see here, we've got how thick it is. And then we've got our little ridge in the bottom of our navicular bone, which is called our sagittal crest. And our median lateral deep digital tendon loads sit either side of that. And when we get tendon lesions, we quite often get a tendon lesion on either side of that lobe. And in our far picture here, we've got our distal impar ligament, and there's our little articular surface to P3. Now, this is just another sagittal section, just to show you the navicular bursa from a different angle. So the main function of the navicular bursa is to provide a lubricating surface for that tendon to run over. However, it plays a massive role in dissipating forces through that joint. It protects that navicular bone a little bit of like a cushion to help stop it remodeling. And navicular bursas are very sensitive structures. It's really easy for a horse to get bursitis. And we can see how close that bursa is to the frog stay. You can get a bursa injury just from a direct impact to that bone where we get inflammation. And finally, the digital cushion. The digital cushion is a really important part of that area because it supports it underneath. And Lindsay pointed out that the digital cushion changes its composition. It changes its composition underneath the bone. It becomes stiffer, and you've got these ligamentous fibers that help to support the tendon and the all the structures in place. Now, what actually causes navicular? Well, all horses can get navicular. Navicular changes and injuries have been found in wild and feral horses that have never been in training in their whole life, although they do have to walk long distances to find food and water. But there's a big hereditary component to this, and stud books in Europe have started radiographically grading navicular, and if they've got a certain grade, they won't breed from them, and they've had good results for that. But really it is a biomechanical disease, okay? So because we ask them to do what we ask them to do, we get injuries, and it's from that constant compression, tension and load on that navicular area. There's such incredible forces going through there, we get remodeling and injuries. From experience in the last sort of 15 years, I've seen a hell of a lot of navicular bursa, distal impar and tendon lesions over the bone in sport horses and dressage horses. And I'm sure this is to do with their vertical way that we work them. We work them in a collected outline in a vertical way, instead of without much forward motion. So when they're breaking over and then pushing all that body weight straight up in the air and then coming down and loading on that area. And we just get abrasions around the deep digital flexor tendon and inflammation around the joint. And we can just get plain injury. So it might have perfect navicular quartile, perfect navicular bones, but we can get impacts, or whether they're galloped around a corner or they catch a foot on a medial lateral torque in the wrong way, we can just get a plain injury. And then of course there's our vascular theory. They kind of go hand in hand. And if that vascular structures, if they're restricted, we just get degeneration of the bone. It doesn't get the nutrition that it needs. Now, how can we influence the joint as a farrier? Well, a really easy way to understand this is to look at moment arms. And moment arms are used in biomechanics to calculate force. And the extensor and the flexor tendons kind of work in opposite forces to create locomotion in a kind of a yin-yang approach towards life. But the moment arms that we're really interested in is the moment arm of the DDFT that influence the DDFT, or the DDFT influences the moment arms. And so the DDFT needs a force to pull on, so a force resisted, okay? And in one case, that is our point of breakover. Then we've got a moment arm to our center of rotation, and then a horizontal moment arm to our DDFT, and their force applied. Now, it's pretty simple, okay? The longer the moment arm, the more force the DDFT and the muscular tendinous unit needs to apply to bring that foot into locomotion, to lever that over the toe, which is why long toes over a long period of time is a negative thing on a coffin joint. You'll get degeneration just because it's constantly overloaded, and not just when we work them as well, just whilst they're standing in their box in the stance phase. Now, horses don't just stand still or just break over the toe. They go through their stride phases. One thing we have to remember is under load, everything is compressed. And these moment arms of the rotation areas of the pastern, the coffin joint, and the fetlock get longer as that fetlock's hyperextended. And we can influence that with our shoeing. The SDFT and the DDFT are two completely different animals, okay? The SDFT stretches between 14 and 16% under peak load, okay? It's really part of that kinetic energy and how that limb recoils. However, the DDFT only stretches between 2 and 3%. It's a real kind of cable that's used to winch that area and leave it over the toe. So as that breaks over, our peak load for our DDFT is during those breakover moments, so heel off the toe. So that's why we have to consider not necessarily putting a breakover on a foot, on a shoe. Sometimes putting a breakover on a shoe is a negative thing, but is how we trim that foot into balance. That's the most important thing, so we can get the optimum amount of breakover. Now, how we shoe the back of this foot is super important. So we can influence all of these moment arms by what type of shoe we put on, what section, how long, how short we shoe it, what packing we put in, etc. Because on a surface, it completely changes, okay? Under load, that foot will sink and depress into the surface. The deeper the surface, the more that coffin joint has to work, okay? And one thing that is completely out of our control is the quality of our owners' surfaces and also what they take them through at competition. So our owners might have the best surface out there, a brand new surface that's well maintained, but then they might take it to a competition where the surface isn't maintained, or they might be going at the end of the show when all of that surface has been kicked up. But we can influence that with what we put at the back of the shoe and what type of shoe we put on. And the best way to do that is just to think about surface area, okay? So if I've got a horse that's gone a little bit coffin jointy, it's slightly positive to a coffin joint flexion, like I will probably just put a bar shoe on it. A bar shoe is probably the most useful shoe that I've got in my van or that I can fabricate to put on. And what it does is it changes the moment arm in the back of the limb. It props the back of that foot up and stops it sinking and opens that coffin joint up more than it would on a hard surface, because the toe's going to sink in a little bit more than the heel, so we've got less derotation of that joint. And if you want to go the full Monty, just fill it up with a packer all the way to the top for a surface, so you keep that on top of the surface. So it doesn't really matter whether that surface is deep or hard. We're going to have a consistent ground reaction force and loading all the way through that stride phase. Now, packing is really useful for supporting the posterior third of the foot, offering protection and support to the foot. It controls foot balance and deformation. We can influence the range of motion in the coffin joint because we can pick that up and stop the sole and the digit sinking within the hoof capsule, and we control vibration on different substrates. So if we've got a horse that's hypersensitive to working on different surfaces, if we put a packer or a pad in, we can control that so it'll work the same as at home as it would at a competition. Now, this is an animation that I did about 12 or 13 years ago on PowerPoint, but it still applies. It's highly exaggerated. But when that load comes down, that hoof capsule's under force and the hoof wall starts to deform. You get hoof capsule deformation, and that diaphragm of that sole will sink. But if we put a packer in it, we prop everything up into place. However, we have to be so careful with what packers we put in horses with inflammation within the coffin joint, because we can make them better, but we can also make them worse, and we can also prolong the recovery period. And part of our role as a farrier is to get these horses back on to the competition circuit, or get our owners back riding them as quickly as possible. But what we do in the first instance is really important. Now, all of these pads and packers look perfect, don't they, for supporting the back of the foot and helping to support the coffin joint area. However, if we've got any inflammation around that distal navicular quartile, so distal impar ligament, navicular bursitis, which is really compressible and highly sensitive, or DDFT lesion, putting a 3D pad on it or stuffing a load of impression material in it might be the best thing to do in the long term. But in the short term, in that recovery period when it's off work or it's on restricted hand walking, we need to try and remove all compressional forces from that area. So when that joint's medicated, we're going to suppress that inflammation really quickly. And over the years, I've learnt this kind of the hard way as well. I've definitely been guilty of making horses slightly worse. And I think I've probably been a bit guilty of prolonging that recovery period. And how you go about that's really important. Now, a hoof pack and a dental impression material are two completely different structures, different products, okay? So if you get a 25 Shore rated in impression material and a 25 Shore rated in a pour-in polyurethane hoof pack, just do it. Put some on the anvil, pour a bit out, let it set, and feel the difference in the two materials, okay? So impression material is brilliant for giving the horse an external digital cushion and propping the back of that foot up. However, it will compact the navicular quartile area, whereas hoof pack, what it does is best properties, it adheres to the sole. It's super sticky, and if you've ever tried to get a hoof pack off just after you put it on a dried foot, it's really hard. And that sticking properties hold that foot in a sling, okay? And then the hoof pack itself, if you use a 25 or a 15, is very, very malleable. And that will be a much better way of dealing with a horse with inflammation in that distal navicular quartile. And after that first month, or that 8 weeks, when that's suppressed and it's walking out fine, you could slowly go back to a hard packing, because that might be better what's for the horse in the long term. So, farrier approach, well, attention to detail in every aspect, unfortunately. Sometimes it's hard because we've got so many horses to shoe in a day, but with our problematical ones, we really have to pay attention to these. And something I am super guilty of is I quite often walk a horse up after I shoe it to see if it's sound, okay? So I can settle my head and go home. But we need to start looking at horses a little bit more before we shoe them as well, especially the ones that have got a few issues. And information will start pouring into your head, whether that horse lands toe first, lateral toe first, heel first, how we can manipulate a little bit of that surface area of the shoe just to reduce the vibration through that joint or just make it land a bit level. AP and medial lateral balance is imperatively important, especially around the coffin joint. We shoe loads of horses, but sometimes we just need to remind ourselves where our center of rotation is. Reduce torque and tension on the DDFT, thinking about our moment arms, and in some cases eliminating or definitely reducing direct pressure around the distal navicular quartile. And just shortening the shoeing cycle is really important, as remember, as longer that toe gets out of that optimum foot growth, the more compression we've got on that. Now, locating anatomical landmarks is something that we kind of need to think about. We haven't got X-ray eyes, but if I gave you all the foot and said, where is the centre of articulation, you wouldn't be that far away. It's at the widest point. And if we've got horses that we shoe all the time, we put our quarters in our shoe in the right place, we can keep that there. But it's a bit more for the younger people here. I just want to kind of tell you how to find it and what you need to find. And the tip of the pedal bone is another landmark which is really important. And I just use a simple foot mapping process where you use external reference points to find internal anatomical structures.
And it's just a Mark Colwell foot mapping. I've used it for about 20 years. Hayden showed it to me when I was an apprentice. And you just take 2 vertical lines on the widest point of the frog, straight down to your white line. You have to find your white line first. 1 across the toe. That's where your tip of P3 is, and that is where your toenails go in your basic shoemaking skills. And then you take 2 diagonal lines across, and that will pretty much tell you where your center of rotation is, as long as you haven't got too much rotation or derotation or sinkage of your pedal bike. Which is why we need x-rays sometimes as well, because what foot mapping won't tell us is it won't tell us whether we've got a medial or lateral tilt on that pedal bone, or whether it's rotated in the toe or derotated, and that might influence our shoeing package. Now, are even proportions around your center of rotation achievable? Well, years ago I was doing a day a week for a vet, so a day a month at a vet clinic. Horses were coming in, and the first thing a vet will tell you is you want 50% in front and behind your crossing joint. And a bit more for the younger farriers in the group.
But back then I was doing some pretty terrible things to think I've got to dress this toe off, I've got to get this toe back to get that 50%. But I didn't really understand it, to be honest. Now, one of the most important reference points that you can find in your trimming when you first pick your feet out is just find the widest point of your frog. It's the first thing that I teach my apprentices, because it actually gives you your true length of that foot. And then we don't trim down to the widest point, we just trim so our foot's in balance, just nice and sensibly. This is just a limb that I got out the freezer, but it's nice to see it on a limb that we can relate the foot mapping to. And we've mapped that out, and you can see where our toenails should go, like where the horizontal line meets the toe. And then we can relate that to internal structures. But what that foot mapping gives you, it gives you the tip of P3, okay? And if you want to shoe 50% in front of behind that, we've just got to shoe back to the widest point and maybe give it a bit of length. You will have to give it a little bit of length if you want 50% behind that. But that's to the tip of P3. Now, that toe in front of that tip of that P is an important anatomical structure for the function of that foot, okay? So it helps in deforming energy in the foot. And if we dress that off, the P3 will actually sink in there and we'll make it negative. But all we need to do, if we want to get 50-50 in front of the thumb, is just put a break over, just put an equilibrium toe on there and bring that back to our toenails. It's pretty damn simple. So I really like my van and I carry lots of things, but I don't carry lots and lots of fancy shoes. And over the years, I've shoed horses of all different disciplines, but I don't carry lots and lots of funky shoes with different kind of breakovers and things. What I do quite often is I manipulate shoes that I've got in the van. So I've got a generic shoe for a surface or a generic shoe for an eventer. And then I build things into it. But one thing I couldn't do without is my fabrication setup. And I've just got a copper welding plate, which is on the bulkhead. So I just pull that out, chuck that on, and then I'm ready to go. Everything's plugged in. And then one of my favorite things in the van is just a simple pull-out vise, because it enables me to manipulate my shoe with a grinder, tidy up all my welds, and get everything looking nice. And if something looks nice, and it looks functional, and it looks right, it will work. Sometimes I've seen inserts welded into shoes with big lumps of weld on, or welded in a bit crooked and stuff, and sometimes that can happen, but we can fix those things. It's a little bit like shoemaking. Sometimes we don't make the best shoe, but we've just got to fix those things. And the 3 inserts that I would use most really for navicular issues is a center bar, so I can cover that area, a straight bar, so I can pick the back of that foot up, and a spider plate. And straight bars are dead easy to fit inserts. All you got to do is fit your shoe up first, okay? And then you can fit your insert to that shoe. So whether you need to just grind another heel check in there and slip it in, and then you can weld it up. Quite often with navicular cases, what I'll do is I'll weld it a bit more to the ground surface, so it acts a little bit more on a surface, so it just press up against that frog. But it's a dead easy shoe to fit. Okay, so this is a sort of typical broken back, low heel, long toe foot. And I just wanted to demonstrate how I would fit a shoe like this. So I've mapped it, okay? And all I do is I just fit that shoe around the center of rotation. So I've got 50% in front and behind, and then I've got a nice breakover just to ease that moment arm in the toe. We can change our hoof pastern axis. We're taking pressure and torque off the coffin joint, which is really important. So horses stand around in their box or in a field for more time than they do work. So how we change the posture of that horse is really important. And hoof pastern axis is desperately important about taking the torque off the coffin joint. And there we can see we've just got 50% in front of the hind. And it's a side clip. So I do use side clip, probably about 20% of my horses in side clips. I'm not a side clip hater. If I can get them in a toe clip, I can. I think they're much better. But some horses, you need to use a side clip just to maybe set that back a little bit and just take that pressure away. And also with this horse, so I took this horse on middle of the competition season. It was in side clips. There's no way I'm changing that back to a toe clip in the middle of the competition season. But long term, I might get this back into a toe clip, and then we might be able to control that toe a little bit more. Now, heel elevation is massively important sometimes when we're trying to take pressure away from that navicular quartile. In the long term, I hate elevating heels. I think I've got 2 horses in graduated pads that I might have been pushed into a corner with, but it's fine, we do it. But the way, when we got graduated pads on, sometimes I just don't like the way that they land. They kind of land a bit heel first as well. And then once you've got them in graduated pads in a full time on some feet that have got a low pile of process, it's hard to get away from it because you kind of crush that heel. However, in the short term, when you're trying to get pressure off the navicular quartile and alleviate some of that inflammation, it's really beneficial. But we've got to remember what it does to the other structures in the limb. So if you elevate a heel, you immediately take pressure off the DDFT. However, you increase the moment arm in the fetlock and also in the pastern because you push that forward. And when we're dealing with navicular suspensory injury, we just got to remember that because we push that pastern forward and we'll tighten that up. Now, there's that. And in the short term, I might even leave that completely open under there. If you've got a horse on box rest, okay, so it's come in, it's lame, it's got inflammation around the navicular quartile, distal impar, and tendon lesion, we've got to suppress that inflammation as quickly as possible. And what we do in those first few weeks is imperative to the recuperation period of that horse, okay? And I might leave that open. So all I do is I put a center bar over it to take pressure away from that navicular quartile. It's medicated. You push it into the stable for a few weeks, and then you can fill it up with a soft pack after that. But you've got nothing pressing on that area, and you can get horses sound pretty quickly. There's just another way of doing it with a spider bar and an adhere wedge. And if it's got a tendon lesion, you can always put a natural balance show on for a short period of time. Just because you've just put one on for the injury doesn't mean to say you have to keep it on it full time. And all I do with that is get my adhere, build up the back of the shoe, and I can grind it down to a desired weight and desired height and create that negative space. I think it's really important. And with these shoes as well, you can come back and refit that and then take that down a bit more so you can very slowly graduate it back down. Now, I always carry a few of these old school wedge pads in my van. They've kind of gone out of fashion, and yeah, they do wreck heels if you leave them on permanently without anything in them. But in the short term, it's a brilliant first aid thing to have in your van. If you've got to elevate a foot quickly, okay, you can just fit your shoe, rivet the pad in, okay, and you've elevated it. Might only be for the one shoeing cycle you do that, just to take the pressure off the DDFT. I've also put these on at shows as well. So we've been at a show, we've got something that's been a bit coffin jointy, okay? If you can open that joint up in the short term, just put that on for 48 hours just to get it through that show. It's brilliant. Then you can take it out and then hatch a plan. But what you must do is you must use a super soft pack within that, okay? And I always go for a 25 or a 50, but I'd much rather use a soft pack than an impression material so we don't compact that area and hold that foot in a sling. Now, center bar is really useful because it just goes over the joint, okay? However, it is really important that we put it in the right place, and it's really easy not to put it in the right place. And we just do our simple foot mapping technique. We tack it either side, okay? Let's take it back to the foot. We can make sure it's in the right place. Finish welding it up. Give it a good grind up so we make it nice and smooth. So we've got a nice, when that foot lands, we've got a little bit of slide as well. If we've got big lumps of weld on it, it'll be a little bit like a rope in. But we're eliminating compressional faults, for not only from the substrate, but from anything in that foot. And you can fill it up to the back. But that pack, I can't emphasize enough how it must be soft. And hoof pack and polyurethanes, a lot of people don't use them anymore, probably because when you started using them, you bought a 60 or a 40. And 60 or 40 is a hard pack, like, yeah. You wouldn't really use a 60 or a 40 impression material, would you? And this is a bit softer than that. But it's got to be soft, and it holds that foot in a brace. Now, a few weeks ago, I did a little pilot study with the help of Mark Aitken and his Metron knowledge and analysis. And this is really for my side bone talk tomorrow, where I was measuring caudal hoof displacement, which are what those pins are for. But it really brought home to me what packing does to a foot. And we kind of know it anyway because there's studies out there that have done it. But what I did, I got a cadaver limb. This one's got a big lateral side bone. And I compressed it to 400 kilos with 3 different shoeing methods on it. An open heel, a 25 shore pack, and a 25 pour in with a spider plate. Okay. And what we did is we loaded that, and it gave us a load of results on tilt and alignment and coffin joint height. If any of you are doing a research project and you're going to use Metron, okay, and you're going to load limbs and then x-ray them, you've just got to remember that the fetlock extends down behind the pastern, and the new AI system with Metron can't pick up, it can't make sense of those readings, so you probably have to discard the alignment of P1 and 2. But what this did show us is it showed us what packing does, okay? So this one's got a medial tilt on the coffin joint because it's got a big lateral side bone, so the other side sinks, okay? And with our hoof pack, okay, this massively influenced the amount of tilt on that coffin joint. And there's no difference with navicular. We want to keep that coffin joint level and perpendicular to the other joints too, so we've got less torque on either sides. And it also kept that P3 at a better height in the foot, okay? Probably because it's got a spider plate on and it's got a massive plate underneath, okay? But I'm sure it's to do with the polyurethane that we're using that adheres to that sole. But next, if you ever buy any polyurethane or you've got any at home, just pour a little bit on the anvil and feel the difference between that and an impression material. And when you've got a lane horse, just think, which one shall I put in and which one will influence the internal structures in a better way for that period of time. And spider plates are dead easy. Just fit your shoe up as you would normally. Fit your bar. If your arms aren't quite long enough, all you've got to do is get your hammer and draw them out a bit. But you've really got to get the center of your arms over that coffin joint. Weld it up, grind it up, and there you've got it. And I use quite a few spider plates on sport horses. With coffin joint in shoes, I think we can control deformation of the foot better. We can control the height of the P3 better, medial lateral tilt. And because we use a soft pack, we take pressure away from that area. So in conclusion, it is super important that you relate your shoeing methods to your internal anatomy, but not just your internal anatomy, it's what's going on in there, okay? And if we are lucky enough to have MRIs and everything, we know which structures are inflamed, we know which structures have inflammation, and we need to try and take pressure away from them, especially in the short term. So consider what stage and type of pathology you're treating, which will influence what package you put on, and think about how altering the moment arm of the DVFT will affect the coffin joint just with our trimming our foot in balance, and trying to shoe a little bit longer maybe to the widest point of foot, depending on what that horse is doing. And before, I'm not a saint, and I've got many horses which I shoe shorter. I shoe some national hunt horses, a few hunters and things, and shoeing like that wouldn't be great for them because we'd end up pulling shoes off and then we'll lose the egg integrity of the foot. But if you're ever in doubt, just put a bar shoe on. It's the best shoe in your van, okay? If you think there's a little bit of inflammation in that navicular quartile and it's going a bit sore, if we just put a bar across the back of it and don't put any packing in it, just put it on for a couple of shoes and see how you get on. Thank you very much.
Thank you, Andy. Thank you, that's really interesting. Hopefully we've got some questions on the floor. Any questions? So with your shoe package, would you only use a centre bar on rehab, or do you use a centre bar when they're back into work?
No, I keep a centre bar on it when it's back into work as well. Like, centre bars are brilliant for transferring forces away from the coffin joint area and also protecting it as well. And we've got to remember, when our coffin joint areas get damage and injury, when they heal, they don't go back to a healthy structure. They're always vulnerable. It's just like a tendon injury. When you get a tendon injury, it might heal, but you end up with a weak spot either side of it. So I was sort of talking a little bit more about how we shoe in the short term, but long term, like using a centre bar or a spider plate when necessary, so to keep that foot in a frame a little bit more, will help that whole start loads, yeah.
So when they're rehabbing, you won't put a packer underneath or a centre bar, and then when they come back into work, then you put a packer.
Depends how lame they are and how much inflammation are. If it is dog lane and it just needs that pressure taken away, I will do what I did there. I won't even put anything under it. And because it's a bit lame, it's not bearing a huge amount of weight on that foot anyway. And if it's in a box, you won't see the frog fall through that much if it's not in work. And if it does a little bit, we can fix that at a later date. But what we've got to do is take pressure away from that area and not make it worse by compacting that area, if that makes sense.
Yes, and when would you use a spider plate over a centre bar? Is that just for sinking?
Always for sinking. I think spider plates fully understand what they do. Okay, but the fact that you've got a full plate on the bottom of the bar, it's a bit like a centre bar and a bar shoe put together, really, isn't it? Yeah. You've got a lot more surface area on there. It keeps it on top of the surface a lot more, okay? And that packing hasn't got anywhere to fold at the back of the foot. So if you put a centre bar and a paw in, under load on a press, or you'll see that packing sink a lot more, like it'll compress. But because it's got something to push back to, it helps to keep a bit more like a passive frog support, if you like. So yeah, it supports the area better than the centre bar, yeah.
Very good question.
Going back to the introduction of lecturing, kind of navicular syndrome, perhaps not across all equine disciplines, but certainly you could say for the more advanced competitors in some disciplines. Is this something that we should kind of keep in mind, say when youngsters come into training, to become the advanced event or show dressage? Is this something that we should kind of bear in mind again? This is almost, I wouldn't say a certainty or a guarantee, but you could almost say navicular will be a part of this horse's life, and particularly in its own right.
Well, I think some horses, some conformations, you can definitely, this will predispose things later on, which is why we have to be really on the ball with our shoeing from a youngster right up to the competition circuit. So that's just in our foot balance and sorting our feet out before we go. But everything's kind of preparation, isn't it, really? You set feet up for that horse's career, and that might not be done from one farrier, it might be done from someone like Gavin here that does a lot of young stock, do you know what I mean? And then it goes on, so it's about setting horses up. But yeah, I think definitely some conformations, that's probably another lecture, can predispose navicular in the long term, but I think sometimes we do that anyway. So if we've got a horse which we've got a lot of fetlock hyperextension, do you know what I mean, or a low slung foot or broken back foot, we would put a bar shoe on that early on anyway. Prevention is better than kind of treating an injury. And it depends how proactive the owners are as well. Like, you know, I think trying to keep the owners in the loop and saying, I love the horse you bought, but I'm just letting you know this could be, you know, it's a bit like buying a horse with side bone, which is what I'm talking about tomorrow. We've got fully developed side bones that might pass the vet and everything. I think we have to let our owners know, long term, this could be an expensive shoeing package to go on there to keep this on the road. So it's just about keeping everyone in the loop.
Cliff.
Hi Andrew, thank you for coming out and speaking to us today, putting all your time in to produce those lectures. The pouring pads, I haven't used them in years because they used to, the older harder ones just became so slippery on the surfaces of grass.
Yeah.
People would complain about the horses sliding away. With the softer pads, the softer pouring, are you having similar issues or do you not have that anymore?
No, you still get the same issues. So a pouring pad that you fill up all the way to the ground surface, like, yeah, we do that so there is no depression on the surface, so on a synthetic surface. If you're running horses on grass, like some horses just won't take it, even if you put massive studs in, they haven't got purchase on the turns. But what you can do is you can suppress that if you need to. You see quite a lot of eventers with a thin layer in, don't they? And what they do is they can cut that out before the cross country, don't they? But even a thin layer of pouring will be a much softer material than an impression material, like definitely. But when I did that data collection that I did the other week, I was taking the shoes off, and every time you take, we don't often take impression material off after we shod them, do they? Or we don't try and winch the polyurethane off after we shoe them. But every time I do something like that, it amazes me what different materials they are, even though they're the same shore rating. You can't even compare them at all. And the other thing with impression material, and don't get me wrong, I put impression material in a lot of horses, is they always work like, yeah, you buy a 25 or a 15 or a 30, but is it actually that? Because the moment you open the pots and put your fat fingers in and try and get out the same amount and mix it together, is it then a 25 or not? Like, you know, I think it's a bit of a tough one really, but what I was sort of trying to get across is, like, in that short term, like suppressing that inflammation, a soft jelly pouring, like a 15 really is like a bit like that stuff the kids, my daughter gets, you know, that gooey stuff. It's a little bit like that, like, you know, and because it adheres to the sole, it keeps that foot in a frame, but you haven't got that compaction underneath.
Any more questions?
Thanks, Greg.
Just wondered, do you see the effects of adding weight to the bottom hand now it's the time to see what's in the flat?
Yeah.
But do the benefits outweigh the benefits?
Yeah, it would change the gait a bit, like, you know. Not quite sure how much it changes the gait. Like, I think with dressage riders, you change it all and it looks like quite a clumpy shoeing method. So quite a lot of it is like in their heads, like, you know. But like, I don't really shoe many eventers, but in dressage horses, like, you know, sometimes putting a bigger package on there can support everything and also make it move better because you've got a little bit of weight, because you've got a bit more of a pendulum effect in that swing arm. But the actual weight of it, I don't think is massive. Like, if you take the polyurethane out and a spider plate, I mean, we're talking about grams. I think it just looks like a clumsy package. Do you know what I mean? I think, yeah. I don't know, maybe that's a research project maybe for you to do your fellowship. But maybe that's a research, you know, how weight influences performance and internal structures. I think that's really interesting. I mean, gated horses tend to have no breakover, don't they? Like, you know, so Icelandics and Hackneys, Icelandics don't have heavy shoes on, all they have is no breakover because that has to snap over that. And things like Hackneys, they put on heavier shoes to get that knee action, and there's nothing like that. Like, you know, I think the margins of the weight are quite small.
Any more questions? You talked about breakover. Did I hear you say earlier that breakover can sometimes be negative? As in, as in a bad thing?
Putting a brake over on a shoe. Yeah, definitely. If you've got a Grand Prix dressage horse and you take an upright brake over it and you put a square toe on it, the owner will be ringing up the next day, I promise you, okay, because you will have broken that horse's gait, okay? So if we bring our brake over point too far back, what you do is you speed up that flight pattern, okay? So that foot breaks over at an earlier stage, and all of that effort that they spent in training and getting that horse sat on its hocks, it'll just dump on its forehand like that. And it's about getting an optimal brake over, okay? So I probably only put brake overs on about, off the top of my head, maybe 40-50% of my horses. I don't put a brake over on all horses, and I think horses do need that purchase as well, and they get used to it a little bit, that edge cutting into a surface, they get purchase and push off. And back in my early days when I was doing my day a week at the vet and I didn't really understand getting my 50%, I put a lot of square toes on. And I, those horses definitely didn't need them, and I think it was a negative thing. Like, a horse is a dynamic animal, okay? And when we put a brake over on a foot, we're doing it statically, aren't we? But we have to look at these horses move. And I think our phones and looking at horses in slow-mo has kind of brought that home a little bit as well, isn't it? And our owners, which are like super on the ball and on the case. If something's yeah, they're all experts, but they've got a point as well. Like, you know, breakover is a massive subject. Like, but you've just got to get the point of breakover right for that horse, which isn't for every horse. And yeah, a lot of my horses I don't put a breakover on the shoe, and I think sometimes they're just like, a lot of my horses don't do a lot of road work now, but they're better off just wearing a little bit of a breakover in a direction of travel. And if they are struggling a bit, I will grind a breakover. I'll look at the wear pattern on an old shoe if it has got a wear pattern, and I'll just grind that edge off. So you've taken just a little bit of an artificial breakover. Sometimes that's all you need, just a little zip with a grinder, just to take that edge off. And that's technically a breakover, isn't it? Like, you know, but negative, definitely. Setting shoes too far back, like, you know, is a negative thing, definitely.
Great. Can we give Andrew a big round of applause?